Hi, doctor. Can you tell me about cystic fibrosis?
Cystic fibrosis, or CF, is a genetic disorder that primarily affects the lungs, pancreas, and other organs. It's caused by mutations in the CFTR gene. These mutations result in defective or absent CFTR proteins.
What exactly do these CFTR mutations cause?
Well, it leads to the production of thick, sticky mucus. This mucus clogs airways and causes respiratory infections, lung damage, and digestive issues. Now, let's break down some of the key symptoms of CF. Primarily, there are respiratory issues. Patients with CF often experience a chronic cough, recurrent lung infections, and difficulty breathing. Over time, this can lead to progressive lung damage.
Are there any other major problems that cystic fibrosis can cause?
Yes, in fact, patients can also have digestive problems. The thick mucus blocks the secretion of pancreatic enzymes, which are essential for digesting food. This leads to malabsorption of nutrients, poor growth, and weight loss. Another key characteristic feature of CF is salty sweat. People with CF have high salt levels in their sweat, which is actually used as a diagnostic marker. But CF's complications don't stop there. It can also affect the liver, reproductive system, and bones, increasing the risk of diabetes and osteoporosis.
So what generally causes CF?
It's an autosomal recessive disorder. This means a person needs to inherit 2 mutated copies of the CFTR gene, one from each parent, to develop the disease.
How are you able to diagnose patients with cystic fibrosis?
When it comes to diagnosing CF, we use a few methods. Newborn screening can identify high levels of immunoreactive trypsinogen, or IRT. There's also the sweat test, which measures chloride concentration in sweat. Finally, genetic testing can confirm the presence of CFTR mutations. Managing CF involves a combination of therapies and medications.
Are there any ways to reduce the symptoms of cystic fibrosis?
Airway clearance therapies help to remove mucus from the lungs. Medications can be used to improve CFTR function, and antibiotics to prevent and treat lung infections. Bronchodilators and anti-inflammatory drugs can also ease breathing. Nutritional support is crucial too, with a high-calorie diet and pancreatic enzyme supplements. In advanced cases, a lung transplant might be considered as a last resort option.
How does having CF affect lifestyles?
The good news is, with advancements in treatment, life expectancy for people with CF has significantly improved. Many individuals now live into their 40s or beyond. And ongoing research is focusing on gene therapy and advanced CFTR modulators, which hold promise for a potential cure. In my experience as a clinician, I've seen the incredible resilience of those living with CF. Managing this condition requires a comprehensive approach and a lot of courage, but with the right care and support, patients can lead fulfilling lives.